evening, everyone. There will be consequences, more outbreaks, more deaths. A blunt warning from Dr. Anthony Fauci against reopening the country too soon. Fauci and other top government health officials stepping out from under the shadow of the White House today and into a video conference to break the bad news to a Senate committee hearing that the COVID outbreak is not under control, testing still falls short, and that grim days are still ahead. All as the death toll continued its steady and painful climb. We have it all covered, starting with NBC's Jeff Bennett.
Tonight, a dire warning from Dr. Anthony Fauci. Reopening the country too soon during the coronavirus crisis will cost lives.
There is a real risk that you will trigger an outbreak that you may not be able to control, which in fact, paradoxically, will set you back, not only leading to some suffering and death that could be avoided, but could even set you back on the road to trying to get economic recovery.
A reality check from the nation's top infectious disease expert, which stands in stark contrast to President Trump's push to reopen the country. Tuesday's Senate hearing unlike any before, with the witnesses and many senators appearing remotely by video conference, an all too familiar precaution in the pandemic. 4 of the nation's top health officials responsible for the federal response, Dr. Fauci, CDC Director Robert Redfield, FDA Commissioner Stephen Hahn, and Admiral Brett Giroir, offering their unfiltered assessments. Among the takeaways, Dr. Fauci cautioning it's a bridge too far to expect coronavirus treatments or a vaccine in time for the fall school semester. The head of the CDC could not say when the agency will finally release detailed advice to states about how and when to reopen public places like schools, churches, and restaurants.
When is it going to be released? Because states are reopening right now, and we need this additional guidance to make those decisions.
I do anticipate this broader guidance, though, to be posted on the CDC website soon.
Soon isn't terribly helpful.
And Dr. Fauci says the already staggering U.S. coronavirus death toll is likely higher than what's reported.
The official statistic, Dr. Fauci, is that 80,000 Americans have died from the pandemic. There are some epidemiologists who suggest the number may be 50% higher than that. What do you think?
I'm not sure, Senator Sanders, if it's going to be 50% higher, but most of us feel that the number of deaths are likely higher than that number. There may have been people who died at home who did have COVID, who were not counted as COVID because they never really got to the hospital.
Tuesday's hearing grew tense at times, with Republican Senator Rand Paul clashing with Dr. Fauci.
We can listen to your advice, but there are people on the other side saying there's not going to be a surge and that we can safely open the economy.
I have never made myself out to be the end-all and only voice in this. I'm a scientist, a physician, and a public health official. I give advice according to the best scientific evidence.
As Democrats seized on shortcomings in the Trump administration's response.
President Trump must acknowledge that the federal response has been insufficient and that more people are dying as a result.
But there was one point of bipartisan agreement.
One thing that's abundantly clear, we need dramatically more testing.
What our country had done so far in testing is impressive, but not nearly enough.
I find our testing record nothing to celebrate whatsoever.
Now, the White House has made progress in expanding the country's testing capabilities in recent weeks, though public health experts warn that millions more tests per week are needed to safely reopen the country. Lester?
All right, Jeff Bennett at the White House, thank you. And one of the most striking moments from Dr. Fauci today was during an exchange about kids and the risk of coronavirus. It comes as NBC News has learned the CDC is preparing to issue an alert to doctors nationwide about the signs and symptoms of that mystery illness believed linked to COVID-19. With more, here's Kristen Dahlgren.
Today in Washington, a tense exchange over kids and COVID and what it means as schools consider reopening.
As much as I respect you, Dr. Fauci, I don't think you're the end all. I don't think you're the one person that gets to make a decision. Well, I think it's a huge mistake if we don't open the schools in the fall.
I think we better be careful if we are not cavalier in thinking that children are completely immune to the deleterious effects. But I am very careful and hopefully humble in knowing that I don't know everything about this disease.
The nation's top infectious disease doc pointing to the new inflammatory disease that appears to be impacting a small but growing number of children. Today, a spokesperson for the CDC saying it's preparing a nationwide alert to help track pediatric multisystem inflammatory syndrome. Symptoms can include prolonged fever, rash, abdominal pain, and the inflammation can attack organs like the heart or kidneys. At least 3 children have died, and cases now suspected in at least 14 states. New York now has 100 cases.
It's probably in other states and probably hasn't been diagnosed yet in other states because, again, these children don't present the usual COVID symptoms.
Doctors say the syndrome appears to be a delayed inflammatory response to the virus.
It's severe. It is evolving very rapidly in these children. So they can go from just having fever to suddenly deteriorating over a short period of time.
Fortunately, there are treatments that seem to be working.
My stomach hurt really bad.
Today, Josie Paskvan went home after days in the ICU.
The key is just to recognize the symptoms, keep your child there so that they can get the treatment.
And new evidence today, even kids without the inflammatory syndrome can get sicker with COVID-19 than first thought. A new study from Children's National found of 177 kids who tested positive, 1 in 4 required hospitalization. Nearly 40% of those had no underlying condition. Overall, children are a fraction of those most seriously impacted by COVID-19. But tonight, growing evidence against the assumption they are completely safe. Kristen Dahlgren, NBC News, New York.
As much of the country starts to reopen, the infection rate is surging in some places, according to a White House task force report, unreleased but obtained by NBC News. And there's also news tonight about a major university system already canceling in-person classes for the fall. Miguel Almaguer has late details.
Tonight, in some of the very regions reopening across our nation, a troubling spike in COVID cases, according to new undisclosed numbers obtained by NBC News. The data, compiled by the White House Pandemic Task Force, shows the top 10 areas recording surges of at least 72% over the previous week. Atop the list, Central City, Kentucky, where a prison has helped fuel a 650% increase in infections. Other hotspots include Nashville, Tennessee, Amarillo, Texas, and Des Moines, Iowa, where there was never statewide stay-at-home orders.
We have this huge spike in cases, and I think it's a result of not practicing that stay-in-place order.
With the national infection rate yet to subside, a separate list of locations to watch includes cities like Charlotte, Omaha, Minneapolis, Columbus, Phoenix, and Kansas City. While cases in California are stable, tonight Cal State, the nation's largest four-year public university, says campuses will remain closed through fall semester.
Here in Los Angeles, the stay-at-home orders could easily extend 3 more months into August. It comes as governors elsewhere are easing their orders.
While several states, including Michigan, Louisiana, and Arkansas, are seeing a decrease in new cases, today top doctors warned of opening communities too fast.
Reservation book is full almost for today and tomorrow.
But after this restaurant in Colorado ignored local mandates, its operating license was suspended. In California, Elon Musk defying regulations too, jump-starting production at Tesla, arguing the company is an essential business. As health officials order the company to stop manufacturing, one employee tells NBC News he's not comfortable being back on the job.
I don't see a scenario where I'm not risking my health by going back to Tesla.
Make my way, Paul.
As more businesses revolt and open their doors, tempers continue to flare. In Southern California, 2 men were arrested after beating security guards who escorted them out of a Target when refusing to wear a face mask. Tonight, the fight over reopening getting uglier than ever. Miguel Almaguer, NBC News, Los Angeles.
Now to the troubling news tonight for families trying to put food on the table. While consumer prices overall have been going down during all this, there's been a spike in food prices, the highest spike in decades. Our Sam Brock tonight on where you'll see the biggest changes.
At grocery stores, it's not just the plexiglass and social distancing that are different. Price tags are changing too, spiking higher than they've been in almost 50 years.
Eggs,
first. They used to be maybe $1.49 for the medium ones. Now it's like $2.49, even $7 for the jumbo.
Grocery sales skyrocketing 83% in the middle of March when many stay-at-home orders went into effect.
Have you noticed a small change or a big change in the cost?
No, it's a big change. When I used to buy a bowl of meat for $60, today I'm paying $107.
Compared to last year, prices are up for items like eggs, bread, chicken, and milk. In fact, in just 1 month, the average price of a dozen eggs jumped 16%, more than $3 in some places. Poultry, fish, meat, and eggs were up more than 4%. Cereal and bakery products saw the largest monthly increase ever, about 3%. Even though people are eating the same amount, most are doing it from the safety of home, which is why a lot of produce and dairy are getting wasted. Suppliers are unable to repackage the food that would have gone to restaurants and redirect it to supermarkets. For example, a crate of 360 eggs for a restaurant looks very different than the same 360 eggs packaged the way a supermarket would need to sell them.
Half the food supply in this country normally goes to commercial use. That's restaurants. Well, that demand has dried up, while consumer demand has skyrocketed. And while the supply chain is shifting to meet us, we're paying the price.
Coronavirus outbreaks at meat and poultry plants are also driving up prices. With new social distancing guidelines and workers calling out, production has plummeted. There are also fewer sales and promotions at stores themselves. A run-up on food prices with no clear end in sight. Sam Brock, NBC News, Miami.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.